A very good morning to you and welcome to our social hour. This is another edition of Health and Wellness with me, Shiko Kaitani. Thanks so much for all the support as well as the feedback that we're receiving through our social media platforms at K24 TV across the board. You can see our WhatsApp number at the bottom of your screen, which changed FYI, in case you're wondering, by the way. How comes my text messages aren't going through? Well, that's because our brand new number is scrolling at the bottom of your screen. Tafadhali, make use of it and contribute to our ongoing discussions right here on K24. All right, so research suggests that every woman in the world is at risk of developing ovarian cancer. It's actually considered to be most serious gynecologic cancer. So have marked World Ovarian Cancer Day last week. We also know that May being the month that is Women's Health Awareness Month, we're actually going to be taking this time to raise the profile of this particular disease that, according to ovarian cancer research, is taking the lives of approximately 140,000 women per year internationally, okay? And so this is definitely a timely conversation. We continue this type of discussions that are affecting women across the month of May, and here to at least dissect this particular conversation with us is the CEO and the Chief Pathologist at Pathcare, Dr. Kiran Radia. Welcome to the show.
Thank you, Shigo.
Karibu sana.
A pleasure to be here.
Pleasure to be here. I just love Dr. Kiran's reaction about being on TV. She's like, oh, is that me? Yes, it's all you. Welcome. So I'm assuming this is first live interview you've done, or have you?
Yes, I've done a few before.
Few. Yeah. But every time
like I said, Chico, this is not my scene.
Yeah.
But I do like to share knowledge, and
right.
I think, yes,
okay,
we need to spread awareness. We really do. And when I talk to women and how they neglect themselves,
right,
I get very worried.
You get very worried. And it's interesting because for you, coming from a lab setting, you're very, very proactive on doing the outreach work of it. Like, you would think you're also, dealing one-on-one with the patients themselves, like a general practitioner. Why the love for advocacy?
I think every medical personnel feels that we must be patient-oriented, we must close to them, we must understand what they really want.
Right.
So my job is actually diagnosing that cancer.
Yeah.
And let me tell you, Shiko, ovarian cancer is what we call one of the hidden cancers.
Right.
By the time we pick up in the women, it can be stage 4. That means it has already spread. And why that happens?
Yeah.
Because we just are not
keen,
regular in knowing the cancer. There is so much campaign on cervical cancer.
Right.
In our country, cervical cancer is one of the leading cancers of Kenya. So hence we really concentrate, and it's preventable, we feel, as doctors, with a vaccine and with early detection.
Right.
So, simple pap smear will detect early cervical cancer. Similarly with ovarian cancer, it grows, and the patient will feel a few symptoms. Sometimes, let me tell you, a lot of women will come and say, I got abdominal, I got digestion, I got, very vague symptoms, not knowing that it is related to the ovary. And now, bloating, fullness feeling has been sort of alerted that if you feel like that, please go and get a checkup done.
Right. So when we actually try to look at it on the scale, against other cancers, what can you really tell us? Because when we look at ovarian cancer, also considered leading cause of cancer death, but help us paint a perspective for us on where we are on ovarian cancer.
So ovarian cancer can affect any age.
Yeah.
We can diagnose it in the young girls. There are different types.
Yeah.
Let me start by saying, I was told don't keep it too medical. But
yes, please.
So, but there are different types of cancers in the ovary. I'm only going to talk, when we talk about cancer, there can be lumps which are benign and which are picked up. Benign means they will not spread. You go in and remove the ovary and the patient is okay. But the cancer means that this has a potential to spread in the rest of your body. So, we see cancers in the young girls also, 20s, we can see it in the later on. Different types, but the ones that's common are in the older group. And Shiko, I've seen them in the 40s. No, it's by the time, because it's just a growth. It keeps on growing in you. You don't realize how many times do we feel over ovaries. Hardly ever. If you have a lump in the breast, you'll feel it. But in the ovary, you don't. You just get the bloating, you just get a feeling of fullness and pain in the pelvis. And let's be honest, how many of us will go to our gynecologist or obstetrician only when we are having babies?
I know, right? and this is the thing, because you've highlighted what even I wanted to bring up next. And this is from what I just came across literally while reading more about ovarian cancer. Is that it's actually believed that very many women don't want to make a fuss, in quotes, because of what you're just saying. You're like, I'm not going to go see the doctor because I have abdominal pain. Like, for what? You know?
Absolutely, absolutely. And they'll have the Panadols. And I know one person who changed her whole diet. Can you imagine? Because she thought it was related to her diet.
Oh, geez.
And then some of them will lose weight. Some of them start having distension of the abdomen, which is not a good sign. That's when it's spreading. But they will ignore it. Oh, I put on a little bit of weight, you know. But I'm not feeling well. I don't understand.
But clearly the pain is not that severe if you're not feeling that you have to go see a specialist.
No, it's on and off in the beginning. And you don't feel the mass. It's growing slowly. But then comes a time when it can become quite large and you can feel it. So what do we say? Many women ask me, how can I know it's an early ovarian cancer? And they always want me to do a blood test. Now, we have a blood test called CA125 for the ovarian. But do you know that it is positive only up to 40% of the cancers? So, I tell the women in my wellness, we offer wellness programs. Just to pick up, the whole idea is pick up prevention, you know, pick up the cancers early, where we can deal with them. But many women say, oh, I want to do this marker. It is not. It does not exclude cancer. I want to tell that to every woman. CA125 does not rule it. Don't think just because you've done it and it's negative, you don't have a cancer. What really picks up ovarian cancer in the early is regular visits to your gynecologist.
That's the trick.
And then we do ultrasonography. Many women have asked me, you know, when I go to talk about the wellness, because I become a great believer of wellness program, and we offer it quite extensively, because I really have seen the effect of early detection and then prevention of spreading the cancer. So, ultrasound is the main thing. It's a radiological, simple test, not related to radiation. Go and get an ultrasonography. Go and see your gynecologist. The gynecologist need to do what we say, the bimanual examination, you know, of the sides of the uteruses. They looked at the uterus, they feel the ovaries, and they can pick up the enlarging ovary very quickly. So, my message to all the women is that please get a regular checkup done. It is not a blood check, but do. When you're not feeling well, go to your doctor. And gynecologist, and you know, we've been regularly told that you must go to your gynecologist at least once a year, and if you can't manage, at least once in 2 years.
Absolutely, very, very important. So two things here that I actually just want to bring up. You know, we have this kind of conversation, this campaign, every time we're talking about cancers, about early detection. So that message is well and clear. The question is, what's stopping us, those of us who are even as exposed, you know, to this messaging of early detection saves lives? So What are the reasons why people don't actually go for screenings? Is it a cost factor, Daktari? I mean, what's your assessment of it? Why do women just
it's not the cost factor alone. Let me tell you,
Yeah.
Shigo, I get shocked.
Yeah.
We were having a campaign on cervical cancer. Last month,
Yeah.
we did a lot of cervical cancer. And when we pick up the abnormal cells, I was shocked. A couple of women told me on the phone when I'm talking to them that we found this abnormality. Oh my God, I wish I'd never done it.
Right. And in fact,
that was the reaction.
Right. The fear of knowing.
The fear of knowing. And my God, I wanted to tell them, but we picked it up. You're not going to have cancer spreading now.
Yeah.
It's early detection. We can do something about it. But that was the first reaction. And it really shocked me.
Yeah.
The fear, I think,
Right.
of something happening.
Yeah, you'd rather just not know.
Not know.
Right.
Which is not a right thing. Because remember, any cancer, early detection will be curative in most of the cases. So even in ovarian cancer, when we look at it, the surgeon usually, the gynecologist will submit the ovary, which is enlarged.
Right.
We cut it and then we look at, we diagnose in PET kit. So when we look at the capsule, the most important thing in stage 1 is to make sure it hasn't gone beyond the capsule.
Correct.
So we look at it very carefully, what we call stage it, then the doctor knows what to do.
Okay.
And voila, it's gone. You picked it up very early. You don't have to worry. And then the women who are in fear, whatever reason, or because they're so busy,
you just keep
they rather look after the husbands and the children than themselves.
Right.
By the time they present at stage 4, it has spread everywhere.
Right.
It is very sad.
It is.
I've seen 40 women in their 40s, Why? Oh, I felt a bit of discomfort. I thought it was just acidity. And it has gone to stage 4. Then it's bad. No?
Yeah.
You need chemotherapy, you need radiotherapy, and it's quite an extensive disease, ovarian cancer.
Wow. I don't think we would have even put it, better than that, Daktari. And I think for the women who are watching, this is a clarion call to just put your health at the forefront and those checkups. Because when you say something like people are telling you, I had no idea. And what do you do when it's stage 4? I mean, literally, what do you do when it's stage 4?
It's true. And if you've seen
some of
and if you know some of your friends who are going through it, it's not easy. When it's stage 4, you have chemotherapies, we have management, we have the chemotherapies are becoming better. We have what we call target, but it is not easy. So my message to everyone is get yourself checked regularly. Any symptom you have, don't take it down as acidity lightly. If it's persistent, you feel the bloating effect, you feel the on and off pain in the pelvis. Oh, I had a sudden pain. Once in a while, I can admit it's because of the twist or something. But if it's persistent, have it looked at.
Have it looked at.
No, have it looked at. It's not like I told you, I want to repeat that, Shigo. Women will come and tell me, can't you do a simple blood test? I don't want to go to the gynecologist, I'm not comfortable.
Right.
Or then I said, go and get the ultrasound done. Ultrasound is, the pelvic ultrasound is the gold standard to early detection.
Okay.
So, and like I repeat, there's no radiation, it's safe, get it done regularly and make sure there's no lump.
And I'm glad that you've brought that up as a myth buster, because there's always the perception about doing the screening and people assuming, or women assuming, that it's an extremely excruciating, painful experience. Even the fact that you have to go see your gyna, there's always that fear that, oh, it's too painful. And I like the fact that you're saying it's pain-free, ladies. It's pain-free.
Yes.
It's pain-free. Okay, let's talk about the screening that's actually done for when we talk about cervical cancer, that is, right, Daktari? And there's the perception, by the way, that the cervical check screening program checks all cancers.
I'm so shocked.
Yeah. So why don't you demystify that for us and break it down? Discuss the emphasis why it's important to understand that going for a cervical check screening is not going to be detecting all the cancers
in the female genital system.
Yeah, in the gynecology. Yeah.
Okay, cervical smears are only related to the cervix.
Okay.
And in the olden women, if they're bleeding abnormally after menopause, we might pick up if it's an endometrial carcinoma.
Right.
Maybe that's where it has come from. In an older woman, when she's having what we call postmenopausal bleeding, we can pick up cancer cells of the endometrium from a cervical smear.
Okay.
We can suggest it, and of course, the definite thing is the curettage, but not ovary. Ovarian cancer cannot come down now into the cervix. They are separate organs on both sides of the uterus, and it's very different. Endometrial maybe, but not ovarian.
Right.
Ovarian cancer, and I think you got to know, the women have to know who are the women who should be more vigilant. I think it's coming ad hoc in women, but there is some genetic predisposition. We found out, it has been found during research, Chico, that women who have got breast cancer because of genetic predisposition have got a high risk of ovarian cancer at the same time. So, if you have a family history of breast cancers, please get your ovaries checked regularly, because that gene can express in breast and in the ovaries.
Oh, wow.
Many people don't know that.
Right.
So be careful if you have. And I was shocked. I was talking to some of the youth the other day. I'm just asking them randomly, how many of you know family history? They're looking at each other.
Like, I don't know what my aunt went through. I don't know my mom.
I mean, they said, we never talk about it.
Right.
So have you asked your mother? Have you sat down with her? Have you found? Each one of you should write a history of any history of death in the family due to cancer. Because the chances are you're going to be genetically predisposed. I was really shocked. A youth, 20, 22-year-olds. They said, we have no idea. You don't talk to your mom? No, never about these things.
And chances are each and every one of us, whichever way we slice it, have been affected by cancer, some shape or form. There has to be someone that probably you are related to, may have actually been dealing with cancer.
I was just shocked how ignorant people were about their family history. So the first thing I told those youth, please make sure you sit down with your mother. She's the one who's going to know. The father usually not, it's the mother. She's always the custodian of health in a family.
Correct.
And write it down, all the cancers in the family.
Because this is what you will go and tell the specialist.
Absolutely.
We've had this
and then your next generation, how you have to protect your own next generation, they must know your family history. And if you are predisposed, then please get those checkups regularly. See your gynecologist, get the ultrasound. And any woman who has when you're having baby, how many ultrasounds we do? It's a pleasure.
So many.
Yes, it's a pleasure to see the baby growing and you get so excited.
Very true.
You don't feel the pain,
I did it every month. Literally.
I know, just excitement.
Because I'm like, I didn't feel a movement. Going for a checkup. I didn't feel a movement. I'll wait for a checkup. Like, something's wrong with the baby. Checkup. It's so common. You will do it every 2 months when you're expecting.
Absolutely. And it's a pleasure because you're seeing your baby grow. Similarly, do yourself a favor and get an ultrasonography. It's so painless. And I repeat, no radiation. What are we worried about?
Right. Oh, aren't you just loving her energy this morning? I'm learning a lot. I hope you are too. Ladies, if you are inspired, by the way, by this conversation and you're feeling, okay, it's time to actually take this seriously. You also have some questions that you want to throw into Dr. Kiran. This is the time to do it. We'll be sampling those when we get back after a short commercial break. But remember, at K24 TV, across those platforms, including our WhatsApp number that's at the bottom of your screen. I believe we did an amazing teaser for this particular show on our socials. We'll be sampling those text messages. Dan is our director, so he'll be cueing me shortly. But for now, let's take that short commercial break. We'll see you on the other side. Welcome back. We're having a great conversation in studio with Dr. Kiran Radia. She's the CEO and Chief Pathologist at Pathcare. What are we discussing? Ovarian cancer resources and support. We were just discussing over the break that it's high time that the messaging gets out there. Whichever way you slice it, this is the pandemic of our time. Cancer. How much effort are we doing or putting behind cancer awareness prevention, FYI? Remember back, okay, for those of us who were there, back in the 90s and the 80s, the push to actually talk about HIV and AIDS, okay, the awareness campaigns that were out there were through the roof. And that's because something needed to be done. Same case when it comes to cancer. This is why Dr. Kiran has such a huge passion on educating people. And now that this is the particular month that we're highlighting ovarian cancer, ladies, I hope you are listening up. All right, before we get back into the conversation, Dr. Kiran, welcome back. We do have some text messages that we want to take a look at. Bwana Dan, who is my director, watch text messages, tafadhali, there you go. Derek goes on to say, my sibling was recently diagnosed with cancer. I lack the perfect words to tell her. I don't know what to say to her. My question is, how can I support a loved one who has been diagnosed with ovarian cancer? Wow, look at this. We were just talking about it, Daktari, that how do you go about, first of all, breaking this type of news to individuals who you've seen some abnormality with their cell work? And at the same time, let's just tie this into the importance of helping family and friends figure out how to become support systems. What do you say? Yeah.
You know, I am a diagnostician.
Yeah.
So like I was just talking to you, Ishiko, when we roll out a lot of wellness programs. When we find an abnormality and the person we were rolling out this to, we call them, we counsel them, we try to find out if they have a clinician.
Right.
It is the clinician who must take over. We have counselors who then talk to them. It is not easy to accept, especially if you tell a 32-year-old that you got a cancer.
That's crazy.
It's like the end of the world for them.
Yeah.
So there are factors, you know, there'll be anger. They will not like the person who's given them that, you know, they start becoming very aggressive with the doctors because they will not like, these are normal reactions. And we understand that, who gave the thing. And now, I love this when the family says, how do I support?
Yeah.
They do need support because during, of course, she'll be staged. I don't know if this individual's sister at what stage. I would love to know the age.
Yeah.
That's what I emphasized, that it can occur in the young. When she is diagnosed, I think the family should be counseled also.
Right.
You need to support them. Financially, it's a different thing because treatment of cancer is expensive.
Correct.
That is why we must pick it up early.
And we've got to prevent.
On saying,
yeah.
You know, we use the word, you cannot cripple the family financially. So you got to pick it up early. Be aware. Be where, you know, most of the countries, the developed countries have strict screening programs, which you have to go to, your GP calls you.
Right.
Unfortunately, that's not happening in Kenya. So you are responsible for your own health.
Wow.
So you support them, understand them. What else can you do?
What else can you do?
The disease is a doctor.
Yeah.
Chemotherapy, I want to tell you, chemotherapy, patients going through chemotherapy is not easy. So you need to just support them.
Yeah.
If they don't want to eat, you have to understand why.
Right.
You have to understand what they're going through, why they want to rest.
Yeah.
And if there's an anger, you know, don't push them away.
Right, right.
Deal with it.
Deal with it.
So I personally feel in a patient who has got advanced cancer, the whole family needs to be in it and counsel together.
Correct, correct. I mean, I guess Dr. will be telling us about the kind of resource material that you can have access to, dear viewer, in the event that this is the situation as a family that you're dealing with. Julia, thanks so much for watching. She goes on to say, how does ovarian cancer affect fertility and reproductive health? Very good question. I think this one pops up a lot with you, isn't it? Many women with concerns about, okay, what happens to me next?
Yes. That's a very difficult question, and I would have liked an obstetrician and gynecologist to answer that. But there are a lot of resources now.
Yeah.
When a young woman gets the cancer, you know, again it depends on the staging.
Right.
The oncologist will tell you, the surgeon will tell you, can we do with removing of one ovary? And unfortunately, because some of these tumors are bilateral, then the other ovary also. So what access do you have? I know that there has been a lot of talk about getting the eggs and freezing them.
Before treatment?
Before treatment, because if there is radiation and part of the treatment may be removing the ovaries, removing the both the ovaries.
Right.
So that is one option that has some people are looking at. Can I preserve my eggs? So
but also very costly.
Very costly.
Yeah, egg freezing is not exactly another walk in the park.
And I don't think we have the freezing. I can be corrected on TV if people know different. We don't have the optimum freezing techniques.
Okay, so then that's another situation.
Yes. IVF, there are so many IVF clinics now. I think they can preserve some of these eggs for how long? Not for long terms.
Wow.
It's a very tough question.
It is.
You know?
Yeah, and also it depends, like the way you were saying, on someone's situation. It depends on the situation.
It is stage 4, the doctor is going to talk to her.
Right.
You know, we don't suggest it because he knows your survival time is only 2 years.
Jeez.
It's very tough.
It is. It is. I mean, I'm just goosebumps just thinking about it. Maggie.
But for that question, I do want to say that don't think that every mass is malignant.
Okay.
When we use the word cancer, we use the word malignancy.
Right.
It has a potential to spread the rest of the body. A tumor, a swelling, maybe benign, and we see teratomas, you know, something like a teratoma, like many babies in the ovaries, and those are benign. You remove your ovary, and you're okay with the other ovary.
Right.
You can go on to have the babies.
Yeah.
So don't be scared.
Yeah.
Go and find out what it is. The lump is. Like I just told you, that's what we diagnose. Is it benign or is it malignant?
Correct.
And then we talk to the doctor about it.
Right, right. Thanks for that, Dr. I've just seen another text message pop up. Dan, yes, I think this is, Maggie, yes. Thanks for the important topic, Shiko. Women should be in the know about what's out there. Kindly ask Dr. if symptoms of ovarian cancer are usually in older women or... Okay, so what are you technically seeing? Is this something that...
I wish I could tell her it's only in older women. No.
Right. It's
we
not.
Have
this
seen
is the scary thing.
Cancers in 40s.
Even younger?
Younger ones have, yes. They have a cancer of a different type.
Okay.
So there are different types of cancers. So the younger one we can get even in a child, an ovarian cancer, we call it an embryonal carcinoma. Then as you grow, we have seen granulosa cell tumors, you know, different types of cancers.
Right.
So each ovary will have different types. Like I said, we diagnose those. The ones which are benign, the doctors will be happy, the patient is happy.
Right.
That is malignant. We classify them, and don't think your age protects you from cancer.
Be like, that's for, I'll figure it out when I'm 50.
For my mom, I sure.
But no, your mom, you're sure, no. But even for you,
for you too.
To
so
start,
anytime you feel a symptom, what is a symptom?
Yeah.
A constant ache in the pelvis. You know, a lot of women will get pain associated with menstruation.
Right.
They will get sudden pains once in a while, that is okay. But a constant pain, go
There's
and get it checked.
Yeah.
There's something happening.
Right. Right. In fact, let's have some fun with this one, because one way to also get the messaging out there, and you can see how creative, you know, this landscape is in Western countries. I mean, they're doing everything they can to spread the message, and not even just about, you know, specifically ovarian, but all types of cancers. And you have to appreciate how they do their communication, their PR abroad when it comes to healthcare matters. Yeah, we came across this year's campaign, you know, for World Ovarian Cancer Day. There was an emphasis on BEAT symptoms rather, and BEAT being the acronym here. Let's just, you know, engage Daktari on this one, because when you think of BEAT, B-E-A-T, those are classic symptoms that, by the way, you need to go actually for a checkup. And so, Daktari, allow me to engage you or indulge you on this one, Dr. Kiran, right? When they say that the B stands for bloating.
Yes.
Okay, take it away as we go through the acronym.
Absolutely, you get a bloating feeling.
Yeah.
And some of the patients I've talked to, that was the single most thing. I feel bloating. What's happening? Is it hormonal? At a 40-year-old woman, you think it's hormonal.
Right.
And then the second one is the eating. You feel full all the time. And she says, you know, I don't feel like eating. Are you losing weight? No. I don't think I'm losing weight. And one of them came and told me, I'm actually having my stomach growing. That's a danger sign.
Oh, right. So you're seeing
because
the
there is fluid accumulating in the abdomen. So I was talking to some of the patients, and when they said, oh, I have this bloating and I think I'm putting on, my stomach's jutting out, and I feel full all the time.
Right.
So they got endoscopy done to find out if they have acidity.
Right.
They got all sorts of things done, but not the ovary. And then I said, okay, for her particular, some of them, we do this marker called CA125.
Right.
It was sky high. But I want to emphasize, you know, that it is not the, only 40% of the tumors will show
like
that.
You had said, right.
So,
right.
you know, I said to them, go and see your gynecologist. And you see a big tumor. It had already spread to the lung by the time you know, she started getting these symptoms.
Yeah.
It had already, there was fluid in the lung. She couldn't breathe. So
hidden cancer.
Hidden cancer.
Oh,
one of the hidden cancers like pancreas.
Yeah.
Because they're inside you, they're growing. You don't feel a lump.
Right.
Everybody has this perception that you have to feel a lump.
Yeah.
Not always.
Not always. Okay.
And sometimes paradoxically, when the ovary starts becoming huge, we usually find it's a benign cyst. So even if it's a small, but you're getting this feeling of pain, get yourself checked.
Right. And then last but not
least. And remember
the magic
is gynecologists doing examination and ultrasonography.
And ultrasound.
And ultrasound, Chico, is now available
everywhere.
Right across the country.
It is.
It's even sonographers will be able to pick it up.
Okay, and we'll talk about that in the remaining minutes about what more we can do about that. But as we're clearing this, you know, the BEAT campaign, the abdominal rather, and pelvic pain, as well as the toilet changes in urination or bowel habits. Very quickly, how do your patients or how do the individuals describe what the pelvic pain feels like? Is it almost like a stabbing, a sharp pain?
Dull. And they said, I feel something is pushing.
Oh.
It's like you know, some people have had babies say, I feel there's a baby, you know, something's pushing in my pelvis.
Oh, wow.
And it's a dull pain, but constant. It doesn't come and go.
It doesn't come
and go. And remember, that is a sign. Please go and see your gynecologist.
Dr. You've talked about how nowadays we've got these services available. What more do you think as a recommendation needs to be done? Because when you look at the urban to rural information flow, creating awareness, prevention, screening, all that, there's got to be something we need to do to see an uptake, especially in areas outside urban centers where people are showing up for the screenings. Availability as well could also be a key. What do you think?
I think like what you said, Chico, what you did for HIV, what we did for HIV, everywhere.
Yeah.
You know, when we were doing the campaignings for HIV, remember we entered schools. We taught the young generation. I think we got to do something like that. We got to just awareness. I just mentioned to you, I was never in favor of wellness program. What will it do? What will it pick up?
Yeah.
A doctor at the wellness program, just looking at the questionnaire that is filled in, they will pick up and they say, do you get abdominal pain?
Right.
So they will send the ladies for ultrasonography. Some of the groups actually of women who approach us for wellness program and some of the corporates are becoming very aware, by the way.
Okay.
So they are encouraging us to come and talk to their staff. I think that's a new thing that's happening and it's very good.
All right.
So we do the wellness programs for the corporates, and before we start the wellness program, we talk to their entire employee staff.
Yeah.
And we ask them what are the symptoms and what are then when we go in, those people are actually screened and sent for the ultrasonography.
Right.
In fact, one corporate organization asked us, they got so, involved in this, and they said, can't we do the ultrasonography at the time we are doing the blood checks and all that?
Wow, fantastic, yeah.
And I was really happy, people take this up seriously because they kept on insisting, why don't you do say 1 to 5? And I had to train them, this is not going to pick up the ovarian cancer. And they came around and they said, why don't you bring a mobile ultrasonography so the women can get it done.
Right.
I was very happy with that.
Yeah.
So this is the corporate. Coming to, the urban area, I still get shocked.
Yes, still.
How people neglect themselves, how the women especially neglect themselves.
And you've got the resources,
and
you've got
the
information.
But I'm too busy.
Yeah. Corporate job.
Please, you are important. You are important. A woman is important. Go and look after yourself.
Right.
Now, what do we do in remote areas? There's a lot of sonography. We've started some wellness programs there. Okay. When we did the cervical cancer campaign and did the pap smear, we were surprised how many women moved, and we involved the local organizations to do the training. And so it's all about awareness training, awareness campaigns.
Right.
It's all about that. People do not know. If I'm shocked at how little the urban area people, the educated woman knows.
Yeah.
A friend of mine said, really? I said, did you know? Ovarian and pancreatic
and yet you go for brunch with her. That is so true. Yeah, I mean, challenge to all of us, even to some extent, you kind of feel shame on us. I mean, shame on you for not knowing, Shame on you. But I think this is good news that, you've started rolling out all these wellness programs and just seeing the effect that it has actually on individuals, Daktari.
But Shiko, when we roll out a wellness program, we do a lot of awareness, a lot of education.
Yeah.
That is why I, as a doctor, thought everybody knew everything about medicine. I'm shocked. I'm shocked how much training, how much awareness. Actually, telling them about your health.
Wow.
All right. I'm just shocked.
You're shocked. But Daktari, as we have this 5 minutes, because I'm told we have about 4 to 5 minutes to go before we say Kwaheri, I want you to encourage the men this morning about their role in supporting women with their health care issues, right? We know that this month is also dedicated to Women's Wellness Month, but what is your message to men? It was very interesting because we're discussing in between the break, how proactive are men in terms of their healthcare, number one, and then number two, actually supporting women.
I know you. Yeah. Well, it's on a good note.
Yeah.
A few of them will say, my wife doesn't take care of herself, you know.
Yeah.
But like I told you, most of the time, it is the women who are the custodian of the health of the family. And they're the ones who will do this. So I told a youngster once, he says, what will I, it was Mother's Day. I was talking to him.
Yeah.
He says, I want to give a gift to my mom. What do you think? I said, give her a gift of a healthy checkup.
Right, wow.
He couldn't believe it. He says, I can't believe.
Yeah.
And I said, how many times have you taken your mother for a checkup? It never occurred to him it was important. So my message to the men, look after your mothers, look after your wives, persuade them to go for the regular checkup.
Right.
Yes.
Persuade
and
them.
Please keep your eyes open. Maybe you are not watching your wife of many years because they may be wandering somewhere else, the eyes. So look at your wife and you see a difference in her.
Right.
You know, you feel her belly is distending.
Right.
Please.
Yes.
Be aware and
Be aware,
encourage her
Yeah.
to go. She forgets, a woman tends to forget herself because of her roles in the family.
I love that. I love that. That is such a great parting shot. But also, let's give you the opportunity to share the good news that Pathcare is the first international accredited medical lab. What's this big news all about? What is that?
No, you know, Chika, I was actually a teacher at the University of Nairobi.
Yeah.
And then I went on to a private institution for 16 years to put up their laboratory system.
Yeah.
I realized that unless you are internationally accredited, do you know our research work goes away?
No.
They will not believe that laboratory. So I set up Pathcare in 2002, and with 100% Kenyans, I am very proud because my previous employer said, don't fly, walk. We are not ready for international accreditation.
Right.
So I had that thing in me. I'm going to show you.
Yeah, wow.
With 100% Kenyans and with a little bit of help, we
Wow.
got international accreditation.
Wow, fantastic.
And that's sort of 2004. We were the first in East and Central Africa. I think nobody thought they were ready. They didn't have the confidence. But you know, I'm a pathologist trained in Britain. I used to see what they do. I came back to Kenya. So I'm a second generation Kenyan, by the way. Don't go by my looks. So I came back and I knew we could do it.
Wow.
So once we achieved, Pathcare achieved its international accreditation, I'm so happy to say we raised the bar of pathology practice.
Fantastic.
So today I'm very proud of the sort of pathology practice that's going around in the country.
Congratulations.
Thank
Congratulations
you.
indeed.
And now we have our own body, who actually inspects us. We are inspected. Every laboratory is inspected every year.
Fantastic.
To maintain their...
Well, we want to thank you, Dr. for you and everybody who's in this field for raising the bar, because the fact that you've put Kenya on the map, that means the world. I mean, right now, things like medical tourism are booming because of, institutions or companies such as yours. And thank you so much for what you've set up. So Dr. Kiran, bless you for making time this morning. You've heard it from her. In fact, even she's like our mom right now. So Mama has said, tafadhali, ladies, go and get checked up. Gentlemen, okay, you might not notice what's happening because your eyes are elsewhere. That's what Dr. has said. Focus on the woman. Focus on your wife and support her, tafadhali, because it could be saving her life. If you love this particular conversation and you'd like to keep it going, continue to follow and, of course, comment on our social media platforms at K24 TV. That's it from me, Shiko Kaitani, and of course, Dr. Kiran. We're going to leave it there and welcome our team from Interactive, who will be giving you the very latest on what's trending, okay? Keep it K24. We'll see you tomorrow, bright and early. Bye-bye.